got asked the other day whether Suboxone is safer than methadone. And it's a great question. Which medication-assisted treatment is the best? First point, patients who have an opioid dependence problem, heroin, fentanyl, which is the only thing that's out there that seems to be these days, if they don't use any form of medication-assisted treatment, their success rate is really low, and fatalities are really high. I think the latest numbers came out at 100,000 deaths last year, which is so unbelievable high number. It's just hard to fathom. And one of our staff was in the emergency room the other day with her mother, and within a 17-hour period she counted 5 overdoses that came in of people that almost died but didn't quite. So that's what's out there. Fentanyl has just changed the game, and people are dying so often that really patients need to be on some form of medication-assisted treatment. We of course specialize in Naltrexone, long-acting, and it works really well. Some patients are not really ready for that because their lives are too chaotic and they're not motivated enough, where they really need to work a strong program to stay absolutely off all addictive drugs and work a program. So for some patients, Suboxone is the best choice, and methadone is the best choice for some other patients. So which is safer? Suboxone, binds really tightly to the receptors, the mu receptors, the endorphin receptors in the brain, but only turns the switch on partially. And as you go up higher in the dose, it tends to block a little bit more, so it's really hard to overdose on that. And if people use a lot of drugs, a lot of opioids when they're on Suboxone, they almost never can overdose on it. So it really does protect people from dying. And patients report that they really don't get much of a feeling from it, even if they try shooting up high doses of heroin. Methadone also binds tightly to the receptors. It is a pure agonist, so it does actually give a little effect. And people can certainly overdose and die on methadone if they take too much. That happens usually in the first couple of weeks if patients take too much of it. But clinics are pretty good these days at making sure that doesn't happen. So they both have their strengths and weaknesses. The key, I think, message is that you really need to be on some form of medication-assisted treatment. If you have any questions, please call us. We'd be happy to set up a consultation to figure out what's the best medication-assisted treatment for you or for your loved one, whether it's long-acting Naltrexone, methadone, or Suboxone.